Today is Mr. Dilip Joe, MD and CEO of Manipal Health Enterprises Limited. Welcome to the show, Dilip.
My pleasure.
How did you come into healthcare? Was it by choice, a conscious choice?
No, it was accidental.
Healthcare can be very daunting for somebody who is not a clinician. How did you handle that pressure in the early years of your career?
When I came to healthcare in 2002, was not really known for professional managers. People those days used to talk about FMCT and telecom over the upcoming months. Healthcare never really featured in any conversation. It's a difficult environment, and particularly for somebody who has come from no background. A lot of the time people assumed I was a doctor. I was introduced as head of this hospital, the personnel manager of this hospital. They sort of call me Dr. Dilip Joe. And oftentimes I have to say, no, I'm not a doctor.
A lot of this explosive growth has come in the last 4 years. Is it decades of hard work culminating into the outcomes that we see today, or what are the other drivers of this explosive growth?
Decades of work culminating and people getting more comfort and confidence about the ability of the team to manage geographical challenges and all that. The second, availability of capital, that financial sponsors are willing to return you significantly more in the last decades or so.
And there is also a difference in strategy among the larger chains when it comes to opening new markets. Expanded beyond these metros to smaller cities as well. But there is another school of thought. The third largest chain probably is only concentrated around metros. Which side of this debate are you on?
We cannot ignore the story of the tier 2, tier 3. There is affordability. You're right about the ability to price higher, build a legacy for yourself in terms of customers who would stick to you. Your challenges are different. In a metro, you would find doctors, find managers, find nurses. When you go to a tier 2, tier 3, your challenge is not really putting the infrastructure, finding people to come and work there. The good thing is, when you are a large network, you have the ability to move people around.
What's your differentiated USP that helps you stand out compared to other hospital chains?
So to my mind, the differentiator would have to be the softer side of the hospital. That what is the experience they feel in the hospital outside of the clinical paradigm.
Dilip, we have also seen that some of your peers a very diversified revenue stream. Outside running multi-specialty hospitals, they are practically trying to capture a much larger pie of all ancillary revenue streams that are possible, be it diagnostic, be it pharmacies, be it home care. What's your take on that?
The skill sets that you need to run these different verticals, to my mind, are very different. Diagnostics are quite a lot about logistics. A lot of the time it is about how efficient you are in your collection, diagnostic and reporting back. As Manipal, we believe we are good in our clinical areas. We give good clinical outcomes. We are focused on tertiary and quaternary care. And like you said, there is enough to do in this. And then if there is enough headroom, you are able to get a 15-18% kind of a growth, then that's a good path to be into.
Let's double click on this point. If manpower is the, let's say, recurring cost line item, one would assume that your input cost, the raw material, is actually humans. As you aggressively scale, as the industry also becomes organized, do you think we have built enough capacity on the education pipeline side to support this rapid expansion growth of the provider?
But the point there is that the rural-urban skew that we talked about earlier. In cities, you will find your doctors and your nurses. When you want to go to a tier 3, like I mentioned earlier, that's where you would find that, it is difficult to attract people. So therefore, at an macro level, we are certainly short-staffed, in terms of skill set. We don't have enough doctors, we don't have enough nurses. But as an individual hospital, does Manipal face that challenge? No, because we do attract doctors, we do attract nurses. The challenges would be for people in tier 2, tier 3, maybe standalone hospitals. It's not a challenge maybe not for Manipal, not for any of the large organized players, but for the sector, it's a challenge.